Women's Health Wednesday and the ongoing concern for so many women to try to keep our kids safe when they're online. Local psychologist Dr. Julie Morrison and licensed mental health counselor Laura Liebrick are here now to share their efforts and the efforts that are underway nationally to try to address this. Thank you both so much for coming in.
Absolutely.
It seems there are dangers at every turn online for our kids, and we worry about it all the time, right?
Always.
The body image concerns, eating disorders, depression, and the list goes on. Online predators.
Sure.
How do we even begin to address this, Dr. Morrison?
Well, I think we have to figure out how to address it at home. And then I think really what we are thrilled to know is that they're looking to address this through legislation. You know, Laura just participated in a press conference recently this week on Monday with a group called COSA, who is putting in their efforts to try to get different states to be paying attention to the legislation that could protect these kids. We were talking before, I think they said something like social media has been around for years and years and years. What, 25? Is that what they were saying? 25 years?
It's been 25 years since any legislation has been passed to put any safeguards and protections in for kids. And we know that social media has exploded in the past 25 years.
So social media is exploding, and yet legislation sort of not really keeping up.
Yes, absolutely lagging behind. So this is the Kids Online Safety Act. There is this effort, right, by Congress to get this passed. And so, Laura, you were able to take part in that press conference that Dr. Morrison was talking about. Tell me what you were able to share locally, Monday in Albany, about, you know, why we need this legislation.
So the Kids Online Safety Act really gives parents tools and resources to be able to put in some safeguards for their kids. We know that kids are exposed daily to things like eating disorder content, self-harm, suicidal behaviors, substance use. In the eating disorder realm, there are 90,000 pro eating disorder Instagram content creators reaching 2 million followers. And then we know on TikTok, every 8 minutes, eating disorder content comes up. So kids seeing that daily, being exposed to unrealistic, you know, beauty standards and toxic, you know, diet culture, the thin ideal, can be really harmful.
So is it more about parental controls in the legislation so that it can get more of a handle on it?
Yes, absolutely.
So tell me, if you could, Dr. Morrison, we're hopeful that this legislation will pass, right? We know it's needed. In the meantime, what do we do? Because these images are everywhere.
And that's the thing, right? So it's in the meantime. It's amazing that legislation is hopefully moving in this direction. What are you supposed to do at home, right? So the number one thing, and I think I say this anytime I'm here, is talk to your kids. Talk to them, and don't be uncomfortable with what they could bring up. If your kid has to go to the internet, they have to go to social media to understand a topic, that means they couldn't come to you about it. Open the door so that they can come and get the information from you, so they're not looking something up, right? We want our kids to know the facts, not to have to go look for those myths that are online. And then I think it's interesting, listen to what they're saying when they're not just coming directly to you. So if one of your kids says to you, if they're an athlete, and they say, I have to eat my chicken and rice, right? That's a big thing, this ridiculous social media thing. Well, wait a minute. That means that something on their For You page or whatever it is said to them that message. Were they looking for it? Maybe not. But maybe they got that nutritional guidance because of their athletic interests. Okay, now I have to pay attention to that. So take a pause. Hey, what did you mean by that? Tell me what you learned. Show me. Let me see, was there a recipe or something? Get interested so that you can start having conversation. And don't tell your kids no social media.
That doesn't work.
As soon as you say no, they're gonna be on it.
All right, we need to be engaged. We need to be asking questions and talking. We could go on forever on this, and of course we're already out of time, but we'll definitely be continuing this conversation. Thank you so much, Laura and Dr. Morrison, appreciate it. For more resources and to find all of our Women's Health Wednesday segments online, go to news10.com. We'll be right back.